Hello and welcome to my channel. So as you can see, today we're going to be talking about how to get your doctor to listen to you. So before I get into that, let me specifically start off this video first of all by saying that I'm sorry for the fact that you feel that you need to get your doctor to listen to you. And specifically, I want to address Black women by saying that I'm sorry for the times that you've been dismissed, for the times that you haven't been listened to, for the fact that you haven't been believed, and for the times that you've been hurt and harmed because your doctor has not listened to you. Secondly, I want to take this opportunity to address my clinicians and colleagues because I am a nurse practitioner. I do work in medicine, so not only have I been a patient, but I also have been on the other side clinically. And I think it's important for us as clinicians to recognize that we have failed many of our patients, Black women in particular, that we have caused them harm. We have contributed to their lack of trust. And we need to take a step back to figure out ways to repair the relationship that we have with Black women. And we need to recognize that we have biases that are impacting the care that we are providing to our patients. And we must do better. We must do better. So with that being said, let me just introduce myself before I get into these tips. My name is Nicole LaShawn, and I am a nurse practitioner with a background in family medicine. On this channel, I help Black women ages 40 and over to create the life that we want to live rather than the one that has been assigned to us. On this channel, I talk about things related to health and wellness, medical tourism, and travel, in particular as it relates to us as Black women over the age of 40 as global citizens in this healthcare economy. So thank you so much for joining me. Please go ahead and subscribe to my channel and leave a comment if you'd like below. And I want to share with you some tips on how to get your doctor to listen to you. So let's get into it. So this is a bit of a challenging topic just because I do feel that we shouldn't have to make our doctors listen to us, right? We as clinicians, nurse practitioners, and physicians should listen to our patients, but unfortunately the evidence is clear when it comes to our interaction with our patients. The evidence is showing us that our patients are not feeling listened to, in particular in our healthcare system here in America. And there are a number of reasons for why that happens, and I can't get into all that. The list is exhaustive. However, at the same time, I do believe that there are things that we as Black women and as patients can do in order to be prepared and in the best position possible so that our doctors will listen to us. And that's what I want to share with you all today from that perspective. So one of the first things that I would say, I can't dismiss the fact that many of us haven't really had good experiences. And in particular, if we're here on this video, it's probably because we've had a situation where we haven't been listened to. And that definitely impacts and can impact the way that we show up for our appointments. With that being said, I think it's important that we go into the appointment, and this is kind of the first tip or suggestion that I would have, going into the appointment expecting a positive give and take, expecting and recognizing that patients and doctors are on the same team, that we are here to work together. And with that being said, the goal is to set up a positive rapport and a good relationship so that we can work toward a common goal. That doesn't necessarily mean that we're always going to agree, but that there are ways in which we can agree and disagree respectfully. So, the second tip that I have is to schedule your appointment with the specific reasons why you need to be seen. The appointment schedule is essentially like the agenda for the appointment. So if you, say, for example, are scheduling an appointment to be seen for high blood pressure, but you also have a headache and a rash that you'd like to be addressed, it's really important that when you're scheduling that appointment or when you're confirming that appointment, that you are mentioning to the scheduler that you not only want to be seen for your blood pressure, but also because of your headache and your rash. And if at all possible, they should add that to the notes of the scheduled appointment. This will allow your clinician an opportunity to prepare, and this will also allow for the appropriate amount of time to be allocated to that appointment so that your concern can be adequately addressed. So just be sure, if at all possible, that the things that you feel are priorities for that day are on that scheduling list. The next thing that I have would be to do some pre-appointment preparation. And what that involves is to take notes on anything important or relevant that you want to ensure that you'd like to communicate during that appointment. I believe that it's really important to prepare, practice, rehearse if you need to, the specifics and the things that you'd like to say, and having written notes are extremely beneficial during an appointment. That's important because appointments tend to run pretty quickly, and it's very easy to recognize that you're at the end of an appointment and that you really didn't cover the things that you felt were important. In addition to that, it's really good to practice trying to quantify and describe what's going on with you. And if you haven't had an opportunity to practice or rehearse that or really think about it, it's going to be more challenging for you to be able to pull up that information impulsively during a visit. So specifically, if, say, for example, we're dealing with pain, think about the severity of the pain on a scale of 0 to 10. When did it first start? So was it a month ago? Was it 3 months ago? Was it 6 months ago? How has it changed? And I would say specifically try to write down the ways in which the condition has impacted your day-to-day life. So were you previously able to go up and down a flight of stairs without pain, and now you're to the point where you don't do any stairs at all because of the severity of the pain? But think about those specifics. Are you now beginning to miss work, or have you cut down your hours to part-time because the pain has become so severe? Are you no longer able to pick up your children, your babies at home because you're having such severe back pain? So think about those things, write them down in the notes, and try to keep it succinct as possible. And this is where rehearsing is very, very helpful, because when the clinician asks a certain question regarding your pain, if you've rehearsed it, or if you said it, or if you've taken a note to kind of quantify it, then you're going to be able to more easily communicate that, and communication is key. Now, I want to say that certainly it is not the responsibility necessarily of the patient to be able to have all of this information. Certainly, as clinicians, doctors, and nurse practitioners like myself, we are trained to be able to elicit that type of information from you, and we will ask these questions. But if you are prepared, if you've thought about it, you're going to be able to communicate more accurately exactly what is going on, and hopefully you're not going to walk away from that interaction feeling like, oh man, I said the wrong thing, or I was nervous and I should have mentioned this. But definitely your clinician should be trained. We're going to ask things related to when did it start? How long has it been going on? What are the aggravating factors? What makes it worse? What makes it better? When does it happen? How long does it last? These are the types of questions that we're trained to be able to obtain kind of a detailed inventory from you. But certainly it's going to be beneficial if you've had an opportunity to think about those things prior to your appointment. The next thing that I would recommend is, if at all possible, try to arrive early to your appointment. This will give you an opportunity to just kind of relax, review your notes, highlight if you need to, or circle a few of the important things that you want to ensure that you are going to say during the appointment. Make sure that you are organized, and that if you have any documents that need to be shared with the clinician, that you have those available. You have done your research, that you feel comfortable in order to communicate whatever it is that you need to communicate in the very short amount of time that you're going to have in that face-to-face interaction with your doctor. The other tip that I have is that as you're being roomed, or when you're being roomed, typically the room attendant is the individual who's going to come and grab you and get your vital signs. They're typically going to verify the reason for your appointment. Again, we're talking about the agenda. They're going to say, hey, I see that you're here for your blood pressure. Is that correct? You're going to say yes. And if they didn't mention the other things that you had hoped to cover on that agenda, make sure that the rooming attendant has those. So we mentioned earlier, we talked about high blood pressure, but you also wanted to talk about your headaches and your rash. So make sure you mention to the room attendant, yes, I was here for my blood pressure, but I was also hoping that we were going to cover headaches and rash. Is that part of the agenda for today? So that's just going to help to verify that the doctor is prepared and has the intention to address the things that you had on your agenda. And that way, very early on, before the onset of the appointment, if there's any discrepancy, that can hopefully be resolved right away. The other thing that I would say is, after your doctor or nurse practitioner, whoever your clinician is, enters the room, very early on in the visit, make sure you again go over those couple of things on the agenda. I know that this sounds redundant, but I want to communicate with you that this is extremely important. One of the most challenging circumstances that we as clinicians deal with is if you had a concern and we don't hear about it until the end of the visit. So as early on as possible, as that you can let us know what your concerns are or what your priorities are, then we can more fully address it, or we can be clear about what needs to happen in order for that to be addressed, whether that can happen today or not. And therefore, we're not miscommunicating with you or making you feel as though you're being dismissed if things are brought up later. The next thing that I would say is, be sure to participate in a dialogue with your clinician during the visit. So try not to hold off till the very end with regard to your questions, but try and have a dialogue back and forth as they're giving you information. Try and ask your questions, just because there's a higher likelihood that towards the end of the visit, as things are closing, if you had questions, number one, you may have forgotten them, or number two, things are wrapping up so quickly and coming to an end that there may not be time for the questions. So if at all possible, just try and keep it as a dialogue. As they're giving you your prescription, you're like, okay, so what are the side effects? What do I need to watch for? That you're kind of trying to keep that dialogue going. A couple of other tips that I recommend. So say, for example, you had a concern and you don't feel like it was maybe fully addressed. Just ask specifically, when would you like to see me back if this doesn't go away? Do I need to come back, or should I call? That's a really, really, really good question. Another question that I recommend is there anything you would recommend that I do or try in the interim until I see you again that could help with this problem? Or a question such as, what are the signs that would indicate that I need to come back or be seen again? Should I call, or do I need to come back? And then, of course, being persistent. So if the issue doesn't go away, make a call to the clinic, to the doctor, or follow up for another appointment if you're able to do that. Another thing that I think is helpful in getting your doctor to listen to you is I use a method called repeating back. So repeating back what you've heard and clarifying the instructions that you were given. So let's say, for example, you're having back pain. So at the end of the visit, you're going to say, okay, so Dr. So-and-so, what I'm hearing you say is that my back pain is because I have a strain. I should take Tylenol over the next couple days, do these stretches, and within 2 weeks, I should see things improve. Is that correct? Am I getting that? And that way, if the doctor didn't communicate clearly or if there's something else that they want to add, they can add that for you as well. Another thing, and this may go without saying, but this is something that I have found clinically should be said. Make sure that you are giving the visit your full attention. Being in the doctor's office is not the time for you to be on your phone, for you to be on YouTube, for you to be carrying on side conversations. That generally makes it challenging to conduct the visit in an efficient manner. And also, you want to communicate very clearly that whatever concerns that you have are important enough that you are willing to be attentive during that visit, because our greatest resource is our time. Your doctor's time or your nurse practitioner's time is valuable, and so is yours. And you want to make sure that you take advantage of every moment that you have in that office to ensure that you are getting the information that you need in order for you to walk out of there feeling as though you had a good experience. You don't want to walk out of there feeling like you were so busy and distracted that you have unanswered questions. So definitely pay attention. And then last but certainly not least, if you are dealing with someone who is not listening to you, who is dismissing you, who is disrespecting you, over talking you, find someone else. Cut ties. Just be sure that you schedule a follow-up appointment with someone else, and hopefully you'll find someone who is willing to give you what you deserve. And let me just tell you that, again, you deserve to be listened to. And that is actually a minimal requirement. We definitely, as clinicians, don't need to hold our patients responsible to necessarily have all of these things together when they come in. We have been clinically trained to do our jobs, but as I mentioned earlier, we're failing certain people. And so with that being said, I want to make sure that we as Black women are armed with some tools and some resources to ensure that we are having the best possible outcome for ourselves. And of course, if necessary, bring someone with you to an appointment. If you don't feel like you're being heard, if you have challenges with communication, when you're sick, you're vulnerable. When you're in pain, you're vulnerable. It's tough sometimes. So if you are able to bring someone with you who can help communicate effectively for you during an appointment, who can advocate for you, then try and bring that person with you to an appointment, or, even if appropriate, have them on the phone during appointments to help you communicate more effectively if necessary. Most physicians and clinics that I know of and nurse practitioners that I know of are willing to accommodate in that way. But thank you so much for joining me, and I hope that this is helpful. If so, please leave a comment, and I would really love to see you all engage in the comments. Leave some tips for one another for things that you have found to be helpful. I also think it's great to get referrals directly from women for with regard to positive experiences with certain clinicians that they've had, and to avoid the ones that women are saying, this one is no good, this one's disrespectful, this one is going to disregard you, this one I've had a bad experience with. And so I think it's good for us to be networking with one another, communicating with one another. Check with your girlfriends to see who they see, who's their gynecologist or who's their primary care provider, and if they're happy with them. And if so, perhaps maybe you would consider seeing that individual as well. But that's all for today's video. Thank you so much for joining me, and we will see you next time. Bye.